Welcome to the Rheumatology series. Rheumatology is a branch of medicine which deals with the diagnosis and treatment of diseases of the joints, muscles, bones, and tendons. The word rheumatology comes from the Greek word rheuma, which means to flow. Rheumatology is the study of the inflammatory conditions which cause pain and swelling in the joints. Some examples are rheumatoid arthritis, gout, and ankylosing spondylitis. A rheumatologist is a doctor who has completed medical school and an internship, followed by a 3-year residency in rheumatology. In some countries, rheumatology is a subspecialty of internal medicine, whereas in others it is a subspecialty of orthopedic surgery or family medicine. After completing residency, some rheumatologists further specialize in a particular area of interest by completing a fellowship, which usually lasts for 1 to 2 years. Rheumatology is a complex field that requires a broad knowledge of many different organ systems. This is because rheumatic diseases can affect almost every organ in the body. For example, rheumatoid arthritis can affect the joints, skin, eyes, heart, lungs, blood vessels, and even the brain. Therefore, rheumatologists must have a strong foundation in basic medical sciences as well as clinical medicine. They must also be able to interpret laboratory results and imaging studies, as well as perform procedures such as joint injections. Rheumatologists typically work in a hospital or clinic setting. Their patients may have acute or chronic rheumatic diseases. Some common conditions that rheumatologists treat include osteoarthritis, rheumatoid arthritis, gout, lupus, scleroderma, fibromyalgia, osteoporosis, and much more. The diagnosis of rheumatic diseases can be difficult because many of the symptoms overlap. For example, pain and swelling in the joints could be caused by arthritis, injury, or overuse. Therefore, rheumatologists must take a detailed history and perform a physical examination to make an accurate diagnosis. They may also order blood tests, imaging studies, or other procedures to help with the diagnosis. Once a diagnosis is made, the treatment of rheumatic diseases is often complex and may require a multidisciplinary approach. For example, a patient with rheumatoid arthritis may be treated with a combination of medications, physical therapy, and occupational therapy. As a rheumatology fellow, my specific area of interest is in autoimmune diseases. These are diseases in which the body's immune system attacks its own tissues. Some examples are rheumatoid arthritis, lupus, and multiple sclerosis. I also have an interest in clinical immunology, which is the study of the immune system and its role in health and disease. In this series, we will cover various topics related to rheumatology and immunology. Some of the topics we will cover include: what are autoimmune diseases and how are they diagnosed? What are the different types of autoimmune diseases? How are autoimmune diseases treated? What is the role of the immune system in health and disease? What are the different types of immunoglobulins and what are they used for? What are the different types of lymphocytes and what are their functions? How does the complement system work and what is its role in the immune response? What are the major histocompatibility complex molecules and how do they function? How do vaccines work? And what is the difference between active and passive immunization? This series is intended for medical students, residents, and anyone else interested in learning more about rheumatology and immunology. No prior knowledge of the subject is required to understand this series. However, a basic understanding of medical terminology and anatomy will be helpful. If you are a visual learner, then this series is for you. Each topic will be presented in a concise and easy-to-understand manner using diagrams, flowcharts, and other visual aids. We will also include case studies and clinical vignettes to help you apply the concepts to real-life situations. So, without further ado, let's get started.